Welcome back to 7 at 4. Many people will be enjoying Halloween by trick-or-treating or even buying candy. And maybe you've even cheated because candy's been on the store shelves since August. So maybe you're eating it now. So we want to make sure that our dental hygiene is in good shape. So we have called on the experts to help us out with some of that. Dr. Karina Miller is joining us. Dr. Karina, thank you so much for being here. You're with Carilion Children's.
Correct.
And so you're an expert when it comes to teeth and getting kids to want to brush their teeth.
Please.
Yeah, please. So let's first talk about, before we get into this, what's kind of the number one thing that you see with children and their dental health, you know, on a day-to-day basis, maybe some concerns you'd like to address?
Yeah, one thing that is really being scary in our world right now, in the dentistry world, is the cavities that getting to kids earlier and earlier and earlier.
Oh, yeah.
So a lot of people say, I'm not going to take my children to the dentist until they are 5 or 6. No, we are having kids 1, 2, and 3-year-old already having like significant condition. And that's due to the increase of sugar intakes.
Sure, especially in processed foods and things of that nature. So it is kind of scary when you think about those baby teeth already having cavities. And doesn't start us out on a good foot. So how can parents and children kind of plan for a fun, tooth-friendly Halloween, if you will? Because it's inevitable they're going to have candy.
We can never say no to candy. I mean, this is America. All holidays are based on candy and treats, but definitely we can do that in a safe way. Well, we want our children to be safe, so parents should be checking anyways for the candies.
Sure.
You want to make sure the candy is not open or anything. And then you start hiding a little bit, the ones that are not so teeth friendly. For example, sticky candies, the gummies ones, the ones that have the sour ones, things that people don't think about.
Yeah.
But the sour one has a very high level of acidity that can really corrode the teeth faster. Sticky ones are harder to brush. So definitely I would lean towards more chocolate, the ones that are easier for you to brush. And I do,
I'm going to hold this up. If they want to get a tite of this, you were talking about some of those candies that we want to hide before the kids get a hold of them. And that's those gummies, the caramel candies.
Caramel, gummies, and I'm not going to name the candies, but there's the hard ones that are very sticky. I've had a patient come to my office with their crown stuck to the candy.
Oh, I believe it.
So the brackets, kids in ortho, definitely we want to avoid those.
One thing that was good to see on here, though, Dr. Miller, was that the better treats are you have milk chocolate, pretzels, crackers. I mean, they love those things.
They love those things, and those are healthier. They're easier to brush as well. So you think about chocolate, once you get the toothbrush in there in the water, it will melt. So it's easier for you to clean.
I see.
Versus
the sticking to the teeth. And also you said some of the best treat choices on here, and I love this, was the dark chocolate, especially maybe with little almonds on there.
Yeah, absolutely.
And gum, sugar-free gum.
Sugar-free. So the sugar-free gum now has something called xylitol, which is a plant-based sugar. It is amazing because it has the bacteria, the monster of the mouth, absolutely hate xylitol. So they start dying.
Okay.
So it's a good thing. And the dark chocolate, the beauty of it, there's a high level of an antioxidant.
Yeah.
And the monsters of the mouth also don't love those. So it has less likely for the sugar bugs to stick to your tooth.
Okay, speaking of sugar bugs, this is why I love Dr. Karina Miller. She actually brought in the sugar bugs today. So kiddos, if you're not watching, mom and dad, show them this segment because we want to introduce you to the sugar bugs. This is who I have to convince my children to scrub off every single night. Tell us who these are, Dr. Miller.
Yeah, so the American Academy of Pediatric Dentistry release every year safety guidelines for Halloween. So we have our tooth decay, we have our gingivitis, and the tartar de terrible. And
they're bad for
not
you.
Good for you.
No, we would have scrubbed those off. Okay, and I have to ask you the official rule. How long should children be brushing their teeth?
Okay.
What's the
Let's
time
put
limit?
a timer.
Yes.
2 minutes.
I knew it.
2 minutes.
Okay.
And nobody thinks they do. I always ask, time yourself brushing, and nobody gets to 30 seconds.
It's good. It's true. We found this toothbrush that has a button and it
Yeah.
blinks.
Yeah.
And it goes off after 2 minutes.
Perfect.
And they love it. I mean, they actually. But my daughter's gotten into this habit, Dr. Miller. She says, "Mommy, can I do 1 minute tonight?" No.
No.
2 minutes.
2 minutes. 2 minutes to kill the sugar bugs.
All right.
But I must say something.
Yes, please.
The candy is not only the type of candy you eat, but it's the frequency. So let's choose a better time for us to give our kids the candy. Don't just leave the Halloween candy sit and they can just free them in. Yeah, no. Let's pair up because, bacteria now, they're there. The bugs are there.
Yeah.
They're just waiting for the candy so they can be very strong and release acid to corrode your teeth.
Yeah.
But if you don't feed them, they get weak.
Yeah.
So how do we do? Best things to do. Give a candy together with a meal.
Okay.
Right?
That makes
as
sense.
a dessert.
Yeah, as a
Makes
dessert
sense.
with a meal.
And then you wait 3 hours at least so your saliva can produce healthy enzymes to fight those bacteria.
Love it.
But if you're sipping on a juice, that's why I don't like sippy cup.
Sure.
Because they are sipping all day long on the
Okay.
juice. Candy. So let's just make sure, give with the meal and then brush. Teach your kids to drink water with candy as well and wash it
Good
around a little
habits.
bit.
Okay, in 2 minutes, and we should be flossing, kiddos. I know you hate it, but we should be
Please,
flossing, even
please.
adults. Dr. Miller, we could talk to you for another hour. We
Yes,
may
I
have to have
could.
you back next week for Halloween. But thank you so much for joining us.
pleasure.
Kids, enjoy the candy, but brush those sugar bugs.
Away.